Okay, so this is big because this is Stratasight's first ever video Meet the Specialist post. And today we are going to meet Dr. Trina Hazzah, and we are really excited to have her because, first of all, she's got a really cool business that I want to learn more about and share with everybody. But also, we want to talk a little bit about just general regulations and opportunities with telehealth and telemedicine and teleconsulting in the veterinary space. So let's get started. Can you tell us a little bit about your background?
Yeah, absolutely. So thank you for having me. I'm excited to do this with you for sure. So I am an integrative veterinary oncologist. And so what does that actually mean? It means that I have done, vet school, and then I did an internship for a year, and then I did a 3-year residency in medical oncology. Then I became board certified in medical oncology. And during kind of my quest, I would say, to figure out what are all the potential options to treat my patient, both in the definitive way, meaning to give them as much time as possible, so increasing survival time in the cancer patient, but also increasing their quality of life. Because I think a big struggle that happens in oncology, not just veterinary oncology, but certainly in veterinary oncology, is we put so much focus on giving them this, longer time being out there for, can they live double the amount of time? But if their quality of life isn't good, well, then that isn't worth it, right? Because if their pet is struggling and not able to eat or vomiting and diarrhea, not doing well, either secondary to the cancer or to the actual conventional modalities, then you start to ask yourself, is it worth it, right? Dogs, unfortunately, and cats, the companion animals I treat, don't live to 70 years old and so forth. And so we need to really make sure the time that we do have with them is really good quality. So what I did was I went back to school, if you will, and got credentialed in Chinese herbal medicine. And during that time, I learned a lot about medicinal mushrooms and nutrition. It's very hard to go into one and not lots of different, alternative modalities. And so I started to learn about Western herbs as well, and even some homeopathy. And I started to realize when I was including some of these other alternative type modalities, my patients' quality of life were so much better. And then I started to look at, well, were they living longer? And they were absolutely living longer, too many of them. So not only was I getting longer survival, but I was also getting improved quality of life. So that's some of my background. I'm one out of 4 veterinary integrative oncologists in the country right now. So that's very exciting to be able to use that status.
Yeah, that's awesome. So yeah, definitely focusing on quality over quantity for patient life, which is so, so important. That's fantastic. So tell us a little bit about what Green Nile is specifically and how you got involved in that.
Okay, so Green Nile is my company. And so what happened is as I was doing, Chinese herbal medicine and practice and nutrition and all these other things, cannabis just was like in my face. I learned a little bit about it during my being certified in Chinese herbal medicine, as cannabis is one of the oldest herbs. But as I was doing my research, cannabis out of all the herbs was the most exciting to me. And partly because when you think of all these different plants, we sometimes focus on just say like the root. So when you think of turmeric has a lot of medicinal benefits, but everyone's focused on the root, right? Of this turmeric root, they take the one compound curcumin and they're focused on that. What I found interesting about cannabis is the plant itself, Cannabis sativa L, is this a magical plant that has over 700 compounds. And each of these compounds have medicinal benefits. So it was like crazy interesting from a mechanism standpoint, because there's actually hundreds of publications on how the different compounds work. Not all 700, but several of them we have a lot of publications on. So putting on my oncology hat and being really nerdy and thinking of, oh my God, look at all these different mechanisms. This one can kill cancer this way. This one can kill cancer that way. Why don't I just put together medicine with all these different compounds and things that I know from, the oncology front and different kind of survival pathways that, programmed cell death pathways and how we can kill cancer, and then going down the quality of life pathways, right? I'm able to put together medicine with different compounds from the cannabis plant and really improve both survival and quality of life for patients. So that became my jam, right? I was like, this right here is really interesting. So I probably practiced cannabis medicine, if you will, for probably 7.5, 8 years so far. And that I was treating hundreds of patients with cannabis. I was practicing in California, so this was the perfect place to start talking about cannabis. I was, really intimately involved in changing some of those regulations, allowing veterinarians to first discuss cannabis legally, and then more recently able to recommend cannabis. And when I say cannabis, I'm talking about marijuana-derived cannabis. So not just a hemp-derived product. We've been able to change these regulations so all 12,000 veterinarians in California are able to discuss and recommend marijuana-derived cannabis, and actually are able to discuss, recommend, administer, dispense hemp-derived cannabis. So that's just in California. I've also helped establish a 501c3, which is called Veterinary Cannabis Society, the first ever 501c3 that's dedicated to building awareness of cannabis as medicine for pets in the United States. And so we've been able to really help other states start to get more knowledgeable about regulation and really get kind of excited about it. So during this process, I was like, wait a second, if all these pet parents are coming to me to help them with cannabis, and I don't have, working in a very corporate type of medicine, I was only able to talk about cannabis a little bit. I wasn't able, I had to talk about conventional oncology. I had to talk about all these other aspects. There wasn't enough time during my hour consult to talk about cannabis to the entirety I wanted to. So with life happening and having children or a child, I said, you know what, why don't I leave corporate medicine and really establish a business of its own where I can then discuss cannabis directly with pet parents and have that conversation for a full hour about the literature, about drug-drug interactions, about any contraindications. And then it also broaden it to, are there other herbs or supplements that pet parents need to consider? And not just for cancer, but for seizure disorders, pain disorders, anxiety, inflammatory disorders in general, not again, just with my oncology background, but now with really a broadened cannabis background. So I established Green Nile Incorporated, which is the company at greennile.org, which is this company that is really, really forward facing for pet parents. And so myself and a colleague who's been trained by me are able to sit and speak with pet parents about cannabis and all aspects of cannabis with an owner for an entire hour. And we're opened up to the entire country, and if honestly, into the entire world. I just had a pet parent consult with someone in the UK last week.
Cool. That's awesome. Yeah. So, going back to telehealth and regulations and things like that, for those that aren't as familiar, every single state in the US has its own veterinary licensing board, and that board regulates what each individual veterinarian can do. So first of all, you've got to be licensed in any state that you're directly providing medical advice for that pet, whether it's in person or virtually. And then there's a lot of states, not California, but most of the other states do have regulations in place that you can't practice true telemedicine without having seen that pet in person in your practice at one point. And so true telemedicine is giving a diagnosis and prescribing medications and treatment plan for that patient. So can you kind of explain to us how you're able to help pet parents across the US or across the world, even though you're not licensed in all 50 states?
Great question. And it's a tricky question, right? I think there's a lot that you have to ride that line very carefully, and that when I have a conversation with a pet parent, they've already signed a significant number of consent forms. So I'm going to make it very clear that everyone has to sign consent forms when they do a consult with me, partly because we're talking about a substance, cannabis, that is currently federally illegal, right? So I cannot tell you to go, use high THC for something. I want to make it very clear that all of my conversations with pet parents are educational based.
Mm-hmm.
They're what I would consider educational and even harm reduction based. So my job is to sit and chat with pet parents without making any diagnosis, without making any formal recommendations. So I am not here to say, quit this, pharma product, start this instead, or it seems to me your pet has a diagnosis of Cushing's or this or that. I am very careful about not making diagnosis. Oftentimes, after pet parents sign a lengthy consent form, they send me the medical records, and it's uploaded to actually a portal system that I use, which is a software that we can have communications, the pet parent and myself, or Green Isle in general can have. And so what that allows us to do as the veterinarians behind the scenes in Green Isle is we evaluate it and say what diagnosis is already made. We are not making them. And then when we have a conversation with a pet parent, we say, it looks like your pet has a diagnosis of, lung cancer. Let's talk through it. And then they give us a lot of the facts. We evaluate it if it's not already in the medical record, and we go based off of that. And oftentimes, let's give an example of lung cancer. Let's say a pet was diagnosed with lung cancer, and they're coming to me from Pennsylvania, let's say. What happens is I read through all the records. I create a record of our own, which is really not a medical record because legally I can't have a medical record. And what I do is it allows me just to kind of evaluate and say, okay, looks like they were diagnosed with lung cancer at this time. There's metastatic disease or not. They also have a history of X, Y, and Z. This is all based off of the medical record I'm reading already. I review it with the pet parent, and I review all the medications the pet's on, right? So we make sure we're on the same page. I then go through the literature with them and say, so glad we're having this conversation. Let's talk about everything that's been published on lung cancer from a petri dish sample, a model, in what do we call it, in vitro, so petri dish or test tube studies, or even animal studies that have been done, so preclinical studies, or human studies that have been done, or even some of the veterinary studies that have been done. Then we go through all of that from the anti-cancer point. Then I go, well, what are you looking for? What is your goal? If the goal is quality life, we look through all the clinical studies that have been published or preclinical studies. This particular cannabinoid has been looked at as profound emetic or anti-nausea. Therefore, when you're looking for a product out there, we want to be really careful that we may look for a product that has this particular cannabinoid. Don't just go rogue and look for something with high THC because the local bud tender, if you're in a state that has recreational, tells you to do that. Let's use science to help guide that pet parent. And then let's look at what's been published on drug-drug interactions. Here are the drugs that your pet is on. Let's go through that. Or let's look if you don't have a holistic vet, I'm here to support you in that way as well. So look, your pet's about to go to surgery and your dog's been on high doses of glucosamine and omega-3. Let's maybe consider looking at the literature and showing they can increase, the risk of bleeding. So speak with your veterinarian, but based on the literature, just know that stopping that beforehand may be safer. Now, am I making a direct formal recommendation? Absolutely not. I'm here as a source that will provide as much education to the pet parent. So now they are well informed. I always tell them any decisions they make on medications or whatever it may be, speak to their veterinarian that they have established a veterinary client-patient relationship, what we call a VCPR in all these states, meaning a veterinarian's already done an exam. Once that's happened, they can go to their vet and say, hey, Trina told me that this is an interesting paper. Can you look at this and tell me what your thoughts are? I oftentimes will say, if a vet has a question, send me an email. And at that point, I can speak with them, right?
So if a pet owner wants to consult with you about their pet and their options with cannabis, what should they do?
Great question. They can go to the website. It's greenile.org. And they can go there. They click on the consultation tab and more information. They get all the information. So if you want to click on there and show them, you'll just go right there and click on get more information. And there you'll get a lot of information about why we're doing what we're doing. You scroll down, you get pricing structure. And then all the way at the bottom, those are the conditions that will help, support. And then as you can see, they're teleconference. They're not telemedicine. Again, that's a big difference in terminology. Teleconference allows us to do these educational conferences. Versus telemedicine was where people can, once I have an established VCPR, then what we do at that point is we have a conversation about, I can make formal recommendations and I can write prescriptions and all of that. Without that VCPR, that established veterinary client-patient relationship, teleconferencing allows me to have this educational consultation. One thing I will say is I do in-person consults, but I do them obviously in California. I don't travel around, and I do it in the Palos Verdes area. About 1 to 2 times a week, I go to a hospital there in Palos Verdes called the Integrative Pet Wellness Center. It's a beautiful hospital where they do all integrative care. And so I will do consultations there in person. So oftentimes I can start with that, and then we can do rechecks over to more telemedicine at that case, because we've established a client-patient relationship. Otherwise, everything else is telemedicine, or excuse me, teleconferencing. And then if you scroll all the way to the bottom, what you'll find is a link. Oh, there should be a link all the way at the bottom, I guess. Yeah, right there, schedule now. So for teleconferencing appointments, you go there and you essentially go in, you sign your pet up and yourself up, and essentially you're creating a profile for yourself and your pet. And then you go into this portal system called eProgress Tracker. There you'll fill out all the forms, and then we do all of our messaging communication there. So essentially, whenever you have a quick message, all of my consultations have a month of follow-up, so you can message me as much as you like with questions, because similar to a lot of other integrative and holistic practices, this one size fits all does not work. It does not work. And therefore, we may think starting a particular product that I will help guide you toward, of course, maybe because it has all the cannabinoids we want and terpenes and whatever it may be that might be able to support your pet in that with their particular condition. What if your pet is 5% of animals, I would say less than 10%, certainly around 5% may have vomiting and diarrhea with a particular product. You can literally use a very similar profile, but with a different product, and that goes away completely. So I don't want you to feel alone where off you go, you start a product, it doesn't work. Well, guess what? Now we can start a product where you're like, wait a second, this might not work. Let me just message you. And then I can say, thanks for the update. Let's switch the dose. Let's consider changing to a different product. Here's an idea of a few different ideas so you feel supported the whole way until you feel like your pet is in a good place. We offer rechecks. So, a few months in, you're like, God, something's changed in my pet's condition. So we can therefore then update, and you can just write me many messages, as much as you need to give me some updates. So that is a little bit of information about how you can make a consultation, a teleconsultation, or in person.
That's so great. I mean, it seems like a really great resource for pet owners. And I think a lot of veterinarians would probably be interested in learning from you as well. One way that we can help pets in other states is by doing teleconsulting. And what teleconsulting is it's veterinarian to veterinarian. So as veterinary specialists, you can offer your recommendations directly to other vets. And then they're the ones with what you said, the VCPR with the client. So they're the ones making the diagnosis. They're the ones prescribing the medications. They're just using you as a resource to help make that treatment plan for their patient. And I know a lot of veterinarians are probably very uncomfortable with cannabis because it is fairly new. Some of the information out there is a little bit less reliable, and it's hard to know, to have time to do all the research and extra schooling that you did to make those recommendations for their patients. So I'm sure a lot of people would be very excited to learn from you, myself included. And also just, on basic oncology consultations as well. And so if a veterinarian wants to get in touch with you, what can they do?
So I'm, honored to be part of the Stratasite platform, where any veterinarian can literally jump right on and say, I'm interested in speaking. Now you have a list of oncologists here. There's 5 of us that they can make an appointment with. I, in particular, do the integrative approach on top of some of the conventional. So if you have an owner that is like, God, these people want to do more than just conventional modalities, then feel free to book an appointment with me. And that's where I'll speak directly with the veterinarian, discuss all the options, make sure they're feeling comfortable, give them as much support as needed to make sure they know, which products, the safety factors, to have the conversation with you about, any drug interactions or contraindications, especially when you're doing conventional medicine. I think the biggest fear now is there a problem of combining? Is it going to make my chemo work less well or radiation work less well? And so I'll be there to talk with your vet and say, actually, here's the literature on, potential synergy or additive effect, meaning it could make it work even better. If we want to be with certain modalities that are conventional, there might actually be an interaction. So I want to make sure that you know timing of when you might want to not give the cannabis or whatever it may be, or other modalities that we might talk about, like, you know, are there supplements? And if I think acupuncture might be beneficial, I might have your vet go out and chat with you a little bit about that and say, look, they may not be doing acupuncture, but there's a list around them that they may know about, or I can provide them a list and say, hey, touch base with some of these folks and see if someone can work, you know, hand in hand. And essentially think about this, that your veterinarian is your primary, you know, go-to person, someone that you trust, someone that knows your pet so well. We're just building that circle with Stratacyte around your primary veterinarian, where I might say, hey, look, I'm here to help you with the oncology section. Or they may have an oncologist through Stratacyte that they're working with, but they want to talk about cannabis or supplements or herbs. So I might be the other veterinarian, and Stratacyte just sits and supports your primary veterinarian. So your veterinary circle becomes so much larger. Your veterinarian is more confident, therefore you are going to be more confident pet owner that you're doing everything you can to support your pet.
Awesome. Well, it sounds like a really great resource for both pet owners and veterinarians. And we really appreciate you taking the time to share all that information with us. And I know I will be contacting you the next time a pet owner asks me about adding on a cannabinoid for their seizure dog. So glad to know you.
Thank you. Thank you for having me, and I look forward to working together.
Awesome. Thanks so much.